before we begin our cardio burst, we're going to open our side body and hip flexors. I'd like you to lift one arm up into the air and grab it with the opposite hand. We're going to cross the leg behind the other, pressing the hips forward and bending laterally. Opening up the intercostals here as well as the hip flexors. The hip flexors are not a posturally tight muscle, but they do get tight due to sitting, which we all do quite frequently with work and travel. The intercostals, the lats, are active and are tight posturally. So we really want to open and breathe laterally here. Inhaling, brace those abs. Exhale. One more breath here. Inhale. Abs in, tailbone reaching back, sternum reaching back. Exhale, side bend deeper. Go ahead and set up on the other side. Remembering to drive the hips forward to maximize the stretch in the hip flexors and to really bend laterally. If you're straining in the neck, you can tuck your chin to chest, lengthen the back of the neck, plug the shoulders down the back. Collarbone is wide. Inhale, brace those abs, and exhale. Each exhale is a chance to bend deeper into the stretch, as long as you're keeping your sternum reaching in towards your back ribs, your tailbone pointing down and back so you have some lumbar extension. You're never pressing the belly out, always pulling it in towards the spine, lifting up on those muscles that stop your stream of pee. Collarbone wide, shoulders pressing down the back. From here, you can release that stretch. The equipment you're going to need is your lightest loop band, your anti-burst ball, and your 3-pound weight. We'll learn all 3 exercises before we begin our cardio burst. Perform these exercises at 50% effort, just so that you can learn them and get confident. Our first exercise will be in the frontal plane, traveling side to side. We'll use our lightest loop band around our ankles, hands on our hips for marching to the side 4 times, standing in place with a soft bend in the knees. We're going to cross punch in the direction we just traveled for 4, 3, 2, 1. Hands back to the hips, marching to the other side, punching in the other direction for 4, 3, 2, 1. So make sure and dorsiflex your feet as you march. That will ensure the safety of the knees as you march here. We're recruiting our hip flexors as we work. Make sure also you don't round your low back, that your tailbone is reaching back behind you. This will ensure you engage the abs and you keep the low back safe. Our next exercise, we'll hold our 3-pound weight on our chest, and you can either do leg reaches, 8 of them, to do a quarter turn, 8, 7, 6, 5, 4, 3, 2, 1, or little scissor jumps. They look like this, 8, 7, 6, 5, 4, 3, 2, 1. Whatever you choose. After that, you'll do 2 reverse lunges, alternating 1 and 2, and then we'll repeat after our scissor jumps or our leg reaches back to the other side, 8, 7, 6, 5, 4, 3, 2, 1, and then 2 reverse lunges. We're just holding that weight at our chest, reminding ourselves to keep the upper back lifted, those upper back extensors active, bracing the abdominals as we step back for that reverse lunge, engaging our glute max and our glute min. These little scissor jumps allow us to recruit our hip flexors. So this is our transverse plane burst. Our final burst will be in the sagittal plane, traveling forward and back. We are going to need our anti-burst ball. We're going to hold it on our chest as we do 8 butt kicks or leg reaches. So leg reaches look like this, 8, 7, 6, 5, 4, 3, 2, 1. And then we'll place the ball between the knees and we'll swing our arms to shoulder flexion as we sit back for a squat, 1 and 2 grabbing the ball, placing it back on the chest for our leg reaches back. 8, 7, 6, 5, 4, 3, 2, 1. Ball between the knees for 2 squats. 1 and 2. Option to run these do butt kick runs with the ball on the chest, forward and back. If you don't have any chronic back pain or knee pain, this is a great option to elevate the heart rate. If you do, I would keep it to the leg reaches until you work on your feet and ankles, balancing them, and aren't experiencing any knee discomfort or back pain. So let's set up for our first burst in the frontal plane with our lightest loop band around our ankles for our marching to the side and our 4 cross punches. And here we go. 4, 3, 2, 1. Cross punch. 4, 3, 2, 1. Keep that going. 100% effort now. Dorsiflex your feet. Reach the tailbone behind you. Brace the abdominals. Give it all you got. 100% effort here. Dorsiflex the feet. Lightest loop bands around those ankles, allowing us to access our hip flexors. Those cross punches allow us to access the TVA. Keep the sternum reaching towards the back ribs. There shouldn't be pelvic movement as you twist and punch. Shoulders plug down the back. Collarbone wide. You're doing great. 100% effort here. Counting you down. 5, 4, 3, 2, 1. Take your recovery. During your recovery, grab a sip of water if you need it. Stretch any muscle that feels like it needs attention. We're going to be repeating this exercise in the frontal plane at 100% effort. We're conditioning the heart. Cardio bursting helps with stress and anxiety management. It also boosts endurance, which is great for your heart health long term. I'm going to count you in. 8, 7, 6, 5, 4, 3, 2, 1, go. 100% effort. Side marching, dorsiflexed feet. That band should be around your ankles, which makes it easier for the marching. And your hands are on your hips. And then we do those cross punches. About chest height, there's torso twisting, but we're not moving our pelvis as we do those cross punches. We've got pelvic stability, so we can really recruit the transverse abdominis with our twisting. Halfway there, 100% effort. Nice marches. Remember to think about that tailbone reaching back so we have lumbar extension. This will help keep your back safe as you pull in and up, and brace your abdominals every time you pick the leg up and you dorsiflex those feet. Those cross punches, give it all you got. Counting you down. 5, 4, 3, 2, 1. Take your recovery. We have a minute here, recovery. Do not sit down. Grab water if you need it. We want to keep the heart moving back to its normal rate and then spike it up into a deep, deep cardio burst. Cardio bursting is recommended 3 times a week. That's the minimum for heart health. And that's between 4 to 8 bursts with a 3 to 5 minute warm up and a 3 to 5 minute cool down. The recoveries between each burst can be anywhere between 30, 45 to a minute. So our next exercise, we have our 3-pound weight. We have our scissor jumps or our leg reaches, 8 of them to turn in the transverse plane, and 2 reverse lunges. Make sure you're really pressing into the bones of your big toes for those reverse lunges so that your knee tracks. Here we go. And 8, 7, 6, 5, 4, 3, 2, 1. Bones of the big toes heavy as you step back into your reverse lunges to engage those glutes. The weight you're holding with both hands and it's resting on the chest. Those scissor jumps are small little jumps, or you've got your leg reaches back. Whichever you're choosing, make sure your tailbone's back. You have lumbar extension. You're pulling your abs in and up, recruiting the lower abdominals. Breathe in, bracing the abs. Keep that going. 100% effort. Scissor jumps or leg reaches. Bones of the big toes nice and heavy on those reverse lunges. Think about the bones of the big toes really active throughout this whole exercise so that once you get to the lunges, you don't have to think about it as much. Even on the leg reaches, if you're walking those, or if you're jumping your scissor jumps as well, really active in the bones of the big toes. Counting you down, 3, 2, 1, recover. You've got a minute here. Grab water. Staying hydrated is really important. You should be having between 8 to 10 glasses of water, and that's 8 ounces a day. And for every cup of caffeine and alcohol you have, you need to replace that with an additional cup of water. Being hydrated is one of the huge factors in weight loss. So if you're not drinking water, commit to a 21-day challenge of hydration, 8 to 10 glasses a day, and an additional cup for every cup of caffeine and alcohol. So I have a cup of coffee and a glass of wine at night. So that means 10 cups of water for me to be hydrated every day. Okay, counting you in, second set in the transverse plane. 5, 4, 3, 2, 1. Give it all you got. Scissor jumps or leg reaches. Tailbone back, sternum reaching towards the back ribs, collarbone wide, shoulders plugged down the back. Those reverse lunges, bones of the big toes are heavy. Knees should be tracking over the second and third metatarsals. Challenge yourself to go a little harder than you think you can. 100% effort. Remember, we're only doing 6 full minutes of cardio bursting. So you really want to maximize your time by giving it all you got. You should be sweating, working efficiently, working safely for your body. Bones of the big toes heavy, tailbone back, sternum reaching towards the back ribs. Brace those abs. 2 lunges, 8 scissor jumps or leg reaches. Transverse plane is where 90% of injuries occur, which is why we're moving in it. This is for injury prevention as well as heart health. Counting you down. 4, 3, 2, 1. Good job. Take that recovery. While we're recovering, I'll remind you of our final exercise. In the sagittal plane, we'll be traveling forward and back with either leg reaches or butt kicks. Choose what's best for your body. At the top and bottom, we'll place the ball between the knees and we'll sit back into a squat, swinging the arms into shoulder flexion and up. Exhale back, inhale up. And then we move back again, holding the ball at the chest for your butt kicks, runs, or your leg reaches back, and repeating those squats. Make sure you're breathing. Make sure you're aware of your feet. You're not pushing your rib cage out or the belly. The abs are bracing at all times. Counting you in. 3, 2, 1. 100% effort here. Give it all you got. That ball is going to go between the knees at the top and bottom. You're going to swing those arms into shoulder flexion, keeping your shoulders plugged down your back, your upper extensors of the back engaged. That serratus anterior, trapezius rhomboids, center of the upper back is working to hold the body in this upright posture in the squat. Shoulders are plugged down the back. Sternum is reaching towards the back ribs. Abs are pulling in and up. Halfway there. Remember those butt kicks to dorsiflex your feet. And every time the feet come in contact with the floor, you're really working through the bones of the big toes to combat the supination. That bow-leggedness and supination, all of which can be combated with awareness of your feet and ankles. Counting you down. 5, 4, 3, 2, 1. Take your recovery. Final recovery and final burst in the sagittal plane. Hydrate. Remember after this to start creating a log for a 21-day water challenge. If weight loss is a goal, fixing your water consumption can be a game changer. Another game changer is sleep. You should be getting 7 to 9 hours of sleep a night. If you are not getting that consecutively, that can affect your hunger hormones. And you're not going to be grabbing salmon and broccoli. You're going to be grabbing caffeine and sugar. And it's just a bad cycle that puts the body into. Your workouts won't be as efficient. So commit to 7 to 9 hours of consecutive sleep a night. Setting up, final set in the sagittal plane, counting you in 3, 2, 1, go. 8 butt kicks or leg reaches, ball between the knees, sitting back, moving into those squats, full range of motion. Make sure when you're doing your squats, you're not rolling back on the heels. You want to feel those bones of the big toes heavy, collarbone wide, upper back extensors engaged. It's harder to find the upper back when you're over-recruiting the front of the shoulders and chest muscles. And since the upper abdominals are overactive with sway back posture, the upper fibers of the rectus abdominis and internal obliques, you really have to think about the sternum reaching towards the back ribs to close the rib cage and not over-recruit to find the center of the back, the rhomboids, the trapezius, and that serratus anterior shoulder anchor. Counting you down. 8, 7, 6, 5, 4, 3, 2, 1. Great job. Take that minute recovery. Grabbing a sip of water, taking any stretch that feels necessary after that cardio burst work. So every time you work with us on your endurance, remember, cardio bursting is the most time-efficient way to condition the heart, but you should be pushing yourself to the limit. As hard as you can go with the awareness of your checkpoints. Your abs are always being braced. You're always thinking about what's happening in your feet, your knee traction, your rib cage, your neck alignment, retracting your chin so the back of the neck is long and the front neck muscles are working.